Good afternoon, and thank you for joining us. My name is Mackenzie, and I am the Community and Provider Education Coordinator for NAMI Maryland. I will be the moderator for our webinar this afternoon. With telehealth expansion across the country, it can be difficult to understand what digital best practices to implement, either as a provider, family member, or individual with mental illness. Today, we are hosting a special guest, Brad Richards, who will share practical ways to make telehealth, teletherapy, and digital communications work together to achieve individual goals and treatment outcomes for everyone involved. I want to begin our webinar by introducing our speaker, Brad Richards. He is a skilled and sensitive psychiatric and behavior interventionist and care navigator. He answers crisis situations quickly, grasping and understanding the facts in a way that allows him to reframe and help those involved to begin moving the crisis to a place of calm and clarity. As a care navigator, Brad creates alliances with individuals and family members, dealing with the impact of mental disorders, autism, and/or substance abuse, and helps to move the person needing care into appropriate services. Brad has a support team of 20 mental health professionals and coaches and works nationally with a broad professional network to help families achieve desired outcomes. As founder and president at Brad Richards, Inc., Brad works as an advocate, mentor, court-appointed care manager, and consultant in care plan development. He holds a Master's of Arts degree in cognitive behavioral psychology with a concentration in behavioral analysis. Thank you for joining us, Brad. Before we get started, I wanted to note a few housekeeping points. To avoid background noise, all participants will be muted for the duration of the webinar. We will be reviewing and addressing all questions at the end of the webinar. If you have any questions as the webinar continues, please enter them into the questions box. This is located at the right-hand side of your screen if you are viewing from a computer, or at the bottom of your screen if you are viewing from a phone. If you have any comments or questions or concerns during the webinar, please also enter these into the questions box. Myself and my colleague Jamia will review and address any immediate needs as they occur. The recording of this webinar will be emailed to each registrant tomorrow at 12 p.m. The recording will also be available on our website at namimd.org for any individuals that were unable to attend this evening. After this webinar today, you will be asked to complete a short survey on the aspects of this webinar that you felt were helpful, could be improved, and what you would like to see in future webinars. This is only one webinar in a series of educational webinars that NAMI Maryland plans to host. We ask that you please fill out this survey to let us know how NAMI Maryland can best support you during this time. Now let's get started with our speaker, Brad Richards.
Hi, Mackenzie. Thank you so much, and I appreciate that warm welcome. It's been really great working with NAMI. It's putting this event on. I want to just talk a little bit about myself and who I am. I work with many different types of people, people who have all different types of diagnoses, all different types of mental health issues and developmental issues. Traveled all across the country, actually out of the country as well, helping different families and different people with many different types of complicated situations. I work within the schools and colleges, the courts, as well as privately over the last 20 years, and I've helped people overcome some pretty incredible odds. I've been in some very challenging scenarios with all different types of people and have found a way to come up with some creative and effective solutions, helping them move forward. In conjunction with my in-person meetings and interventions and life coaching over the course of my career, I've utilized different creative ways of trying to meet people where they're at. During the time of COVID, I've had to try various creative ways to connect with people. many using teletherapy or different types of digital communication. I've discovered that despite the obvious barriers of not meeting my patients in person, the use of digital communication can actually be incredibly beneficial and effective, if done correctly. The use of teletherapy should be very individualized. It should be very nuanced. My goal of this webinar is to focus on strategies and insights from the person's perspective, as there can be many difficulties with the utilization of this modality of treatment. I also seek to address insights and strategies for providers delivering the therapy, with the means to enhance quality and continuity of the treatment. So let's move forward here, and we're going to start with a little quote. The application of telecommunications technology to deliver therapy services at a distance by linking clinician to client for assessment, intervention, or consultation. So that's kind of a comprehensive definition of what teletherapy is. And throughout this presentation, you'll see a lot of different words for teletherapy. There's telepsychiatry, telebehavioral health, e-therapy, virtual therapy, all sorts of different vernaculars. They're pretty much all synonymous with teletherapy. And here you're seeing a diagram. There are different ways to deliver teletherapy. We'll be discussing some of these later, although my goal is to really focus on tips and insights for video conferencing. We'll go into HIPAA compliant platforms, as well as things like the store and forward methodologies, how to use teletherapy to engage people in medication reminders, and so on and so forth. So now with COVID-19, many are utilizing telehealth to try to provide therapy as we socially distance ourselves. If you had a provider that you're using prior to COVID, you most likely had to switch over to teletherapy and make that adjustment. It's just not easy. People are seeking out providers for the first time are really having a lot of trouble, given that they have lost their job or they've encountered increased amounts of stress. In recent memory, this is really one of the most stressful times in human history. So people in need of telehealth are seeking experts, out-of-state providers, are reconnecting with old providers that they trust. So let's talk about how to choose the right provider. It's important, and there are several things you have to consider. For instance, first of all, you need to examine whether your diagnosis or concerns are even treatable through teletherapy. There are some issues that can be quite difficult to address through this modality of therapy. Although not impossible, studies shows that psychosis and emergency situations can be really difficult to effectively handle through teletherapy. There are reasons for this, which I'll get into later. The biggest being underlying communication barrier. Okay, so second, it's important for the patient to ensure that his or her provider emphasizes the importance of confidentiality and privacy. Security concerns in e-therapy is a recurring theme which we'll address throughout this presentation. So if you look at the slide, you can see a bunch of different therapies that are currently being done face-to-face, whether it be telebehavioral health, speech pathology, yoga, anger management. Really a lot of different types of therapies you can be delivered in a virtual setting. A lot of them really actually overlap with the standard face-to-face therapy that you could receive. Some of the techniques actually greatly vary when you're not in person. So like for instance, with occupational therapist, can't do a hand over hand for handwriting. They would need to use an assistant or a facilitator, which that can be a challenge to get the assistant or facilitator on board. So there's a need for the patient to adapt and accept this type of delivery. So these are telehealth services provided by Brad Richards Incorporated. The company has had to make several changes throughout the pandemic. Since I'm really used to meeting people, and people in my company are meeting people where they're at. We provide many types of concierge services to families and to people who need assistance. Given the fact that hospitals are overrun with COVID and that they have repurposed the beds used for mental health facilities, it has become increasingly difficult when these people are discharged directly to their families or to uncertain situations. Really scary stuff. We've had to create separate living situations for people who can't go back to their families' homes and other really creative scenarios. They are not letting visitors into the hospitals. It's a major problem for a lot of people who can't advocate for themselves. It's making it difficult for myself, families, other advocates to directly coordinate with the hospital. As a result, getting consent has been a much bigger challenge, or getting other professionals to respond or even know if they're still working is a challenge. As you can see, these are services that my company and I deliver through teletherapy, which I would normally deliver face to face. On the last slide, I mentioned the difficulty of handling crisis situations through teletherapy. I find it easier to handle situations when there's a rapport with the client. So we use skills that we learned prior to the crisis and maybe use teletherapy in that way. And then try to implement things like de-escalation, escalation tactics, including breathing, having somewhat set up a behavior plan beforehand. Basically, a lot of proactive strategies will make this a lot easier. It's really much more difficult to do this with a new provider-patient relationship, especially virtually. We'll get into that a little bit later. So,
Hi, Brad.
one,
So some
yes,
people are just having a hard time hearing. Is there any way that you could project a little bit louder?
I can.
Okay, perfect. Thank you.
As loud as I possibly can.
Thank
Um,
you.
all right. So let's talk about creating an at-home therapeutic environment. All right. So these are things you should go ahead do ahead of your appointment, right? So like you really want to get these things prepared ahead of time. And I'll actually workshop this with the individual prior to the appointment, try to work out the kinks, whatever it may be. So before you enter your teletherapy session, there are some technological and environmental measures you should take to enhance your experience. So be sure to use the proper equipment, right? So I prefer my clients to use a tablet or a laptop instead of their phone because it provides a lot less distraction to turn on off your notifications and such. And the bigger the screen is actually makes it really invaluable in a therapeutic session because of screen sharing. With a bigger screen, you can see people and see more of their body or see more of different things about them. I also suggest using Wi-Fi instead of data to lessen any internet bandwidth issues. So I would test out your internet bandwidth and shut down any background apps that you may have running, or restart your device before a session, just to make sure everything is going well. Uh, Obviously, if people can't hear you, you may want to talk louder, like in this circumstance. I also suggest to practice using the platform your therapist provides. Some of these can be very foreign to us, especially if you're not technologically savvy. If you're using a web browser, you want to really update that to the latest software. And most of all, just really check in with your provider if you have any questions. And some people may really want to actually do a trial run, which could be quite helpful. Um, as far as your environment, just be sure to make sure that the lighting is really good. You want to have a really quiet, distraction-free space. I know that's not always possible given the spaces that we live in, but try not to sit in a place where there's a glare in front of you, and make sure you have headphones on and perhaps a notepad for your session, or any other materials you need. It could be a guitar to a toothbrush, depending on what you're doing and what you're doing therapeutically with your client. So this is a slide that talks about the benefits in therapy for patients and families. So I'm going to talk a little bit more about that with as far as the accessibility and flexibility, because these are the most obvious and major benefits teletherapy has to offer. I'll also be discussing tips to overcome some barriers and privacy concerns, as well as the effect of teletherapy versus face-to-face sessions. So accessibility is perhaps the biggest benefit that teletherapy has to offer to the patient. So teletherapy is being expanded across the world, often assisting those in extreme remote locations or rural settings. It cuts out the traveling, which can be an issue for those with disabilities or people who are self-isolating. It is being increasingly utilized for students, especially college students, who may not have their normal supports where they would at school. It greatly assists the students with workload management, and convenience factor is really unparalleled. Uh, if there's no expert in your area, teletherapy enables that expert to be present. So this leads me to the next benefit of flexibility. The flexibility gained through teletherapy is invaluable in that sessions are not offered solely through scheduled and limited office hours. This makes it easier for people with many commitments or other conflicts. Reduced wait times is a huge benefit that many patients become accustomed to enjoying. It's hard to find a lot of happy faces in a waiting room. Most likely you find more people being anxious in a waiting room. So lessening those wait times can increase the likelihood of patients following through on future appointments, which we all want to have successful therapy sessions. So with our current pandemic, the federal government loosened up laws on telehealth. One of the biggest changes is that they're now allowing providers to deliver services to patients out of state where they're not licensed. So usually, whatever state the patient is in, the provider has to be licensed in that state. So this is something that really improves and really expands the flexibility. It can prove to be invaluable if permanently enacted post-COVID-19, but we're not sure if these laws will change with a lasting impact. That's something that remains to be seen. So furthermore, they've waived several different HIPAA drawbacks concerning telehealth to allow for expanded flexibility. So for example, all different sorts of apps are now being accepted, like FaceTime, the iPhone application, which is not able to be accessed on an Android, and which is not normally HIPAA compliant. So now even Facebook is temporarily approved for telehealth and other digital communication apps. Unfortunately, TikTok and Twitch are not approved for the use of telehealth. Although apps like that can increase flexibility and have great reach, they do not exhibit privacy risks, which I will address. So privacy is a really big concern that really gets brought up over and over again. So privacy intertwined with telehealth is really a lasting concern for everyone, for both patients and providers. So when implementing services that are reliant on technology, it's natural for security issues to be a growing concern. But you have to rest assured, just like standard therapeutic sessions, there are state and federal laws to try to protect your privacy through teletherapy. So things like providing payment for your sessions via credit card could be considered a security concern. Um, so one of the suggestions that I have actually is maybe even opening up a dedicated card for your teletherapy or just all your internet purchases. So in case of a security breach, you're less exposed. Some other tips to ensure your privacy: you want to use a provider that you're trusted with. You want to listen very closely to the instructions your provider is giving you. You want to make sure your environment is private. You want to use headphones, especially if you're in a tight spot. If you don't want to hear others to hear what's going on in your session, the headphones will have you covered there. You want to make sure your network is secure. You want to have all the signed releases done prior to your session. That will take a lot of the stress out of your session if you don't have to do that within a session. And lastly, you want to be sure to use a HIPAA compliant platform. So during the provider section of the webinar, I'll list some of those HIPAA compliant applications for use. So given all the privacy concerns, there are many people who feel safer reaching their therapist or support team digitally. Sometimes people feel more comfortable revealing more about themselves if they don't have to show their face in person. It's kind of like having a veil. People with anxiety, depression, and OCD may have barriers that make it difficult for them to attend, or even to be honest in an appointment. Oftentimes, through digital communications, for whatever reason, people enable themselves to feel more vulnerable. This is an indirect benefit of teletherapy if used in a nuanced way geared toward that person. Often, when you're teaching something in the office, the person had to generalize that skill in their home environment. Now, when delivering services right in the home, the skills can actually be generalized more quick. So here I'm going to be discussing some specific barriers that teletherapy may pose to certain people. As I've mentioned, teletherapy is really most successful when tailored to that individual. In this unique case, teletherapy can pose a great difficulty for those with body dysmorphic disorder or others who are self-conscious of their appearance, which could really be anybody. This is because they're already anxious about seeing themselves in mirrors, pictures, and reflections, that the mere act of looking into a webcam can be a giant trigger for that person. So CBT and exposure therapy can really help with this. The more times the patient engages the session virtually, they can actually become desensitized to it. We'd also advise that to practice making eye contact with the camera without looking at yourself in the reflective picture. This can translate well to real life, and you don't even really have to look in the provider's eyes. So if this is too difficult for the person you're working with or for yourself, I would advise putting a piece of paper on the webcam instead of directly moving to a straight up phone call. This gives them practice and desensitization of video conferencing. I would also not derail a session into constantly asking for validation on appearance. Validation seeking is a huge compulsion for those with body dysmorphic disorder or who are self-conscious. These types of things are much better worked on face to face. So hopefully, as we gradually transition back to our new normal, exposures can be worked on in combination between virtual sessions and person, using social distancing. So people who feel uncomfortable talking face to face can also record themselves talking and send a video to their provider. So this is also another form of teletherapy called store and forward. So the opposite can be done when the provider sends coping techniques or coping strategies to a patient through video, like breathing techniques or something specific that is geared towards that person. So persons diagnosed with autism or people who have nonverbal learning disabilities may have a lot of difficulties reaping in the benefits from telehealth. But this is really where you have to use some more creativity. So not everything needs to be verbal. There are interactive games, you can do picture cards and speech generating devices that can facilitate your session. I have a client that I worked with that was more open to using Snapchat to communicate. So I was able to use the filter and put my face as a dog. That got him laughing. was actually attending and responding to that, which was fantastic. So eventually we changed my face to without a filter. So in essence, he was desensitized to the screen, and now we're doing longer sessions, and he's getting used to being on the camera, uh, using some filters himself too. Um, so you can do some fun activities like that, or reading or cards to prompt someone's speech. You can have the person be prompted through basic life skills like brushing your teeth. The provider can also record themselves modeling the activity or model the activity live during the session. So lots of different ways to connect verbally. One of the ways to get people interested in teletherapy is really to appeal what they like. So you really might have to assess what that is. Playing a video, playing music for them, maybe a meme. This all may extend the length of the therapeutic sessions and make it easier to interact. So let's talk about some more issues here. So in this scenario, those who have had issues with ADHD may have trouble with teletherapy sessions. Although there are many skilled ADHD clinicians out there, it can be quite difficult for those with ADHD to pay attention. What would normally be an easier face-to-face session. There's a lot of reasons for that, but I would advise doing a shorter session, but at a more frequent rate. So, although done more frequently, this method can help engagement and help the individual process things easier. So you can give them routines and other things to do to work on, like other goals, and then you can actually check in on them later and see how they did it, or assist them with something. So in certain circumstances, people with severe ADHD may need a facilitator to help them remain attentive. Um, Also, medication monitoring can help compliance for those with ADHD or anyone who needs medication monitoring. That could be done certainly through teletherapy. Someone who has ADHD really may have a difficult time monitoring their meds. So you can use that to give them a medication reminder. Um, so I would really ask your provider any questions you have about the medication and have whoever you trust, if it's a family member or a caregiver, be involved in that aspect of the session if it's necessary. Also, shorter meetings can really be beneficial in general, not just in patients with ADHD, but really to prevent burnouts from therapy sessions, which I'm going to get into on the next slide here. So, talk a little bit about what Zoom fatigue is here. So, Zoom is one of the most popular video communication apps that are used for teletherapy in COVID. Um, People use it for other forms of communication as well, meetings and such, business meetings. But recently, the National Geographic coined the term Zoom fatigue to describe the feeling patients get after long, frequent virtual sessions. One study demonstrated that technological glitches, transmission delays, awkward silences, and eye strains really cause fatigue and what's called Zoom gloom in that patient. So the same study actually demonstrated that the mere self-awareness of being watched on a video can cause a tremendous amount of fatigue. So some ways to alleviate the Zoom fatigue would be to take walks and prepping yourself beforehand, doing something you enjoy afterwards, like listening to music or going outside. I really recommend something away from your computer. Um, you know, Limiting the calls to a shorter duration can also mitigate that fatigue. Having your screen off to the side instead of straight ahead is actually shown to make you feel like you're in an adjoining room. So you just want to be mindful that you're not putting yourself completely out of the lens so the other person can't see you at all. Okay, so here's a study. It was actually done by Medscape in 2016. Um, they observed perceived barriers to telemedicine by both physicians and patients. So you got to keep in mind that the survey is conducted regarding telemedicine as a whole, not just teletherapy. So this study found that the biggest barriers for physicians were malpractice and liability concerns. The biggest barriers for patients were concerns about receiving accurate diagnosis and issues with accessibility. So since this survey was done a few years ago with the boom of tech and COVID, and you have to really assume that the concern of access via telehealth has only declined. Other concerns surveyed to the patient, such as privacy and insurance issues, may still exist. However, as we continue to expand telehealth post COVID-19, hopefully we'll find some of these solutions and it'll start to decline. It's another survey where they observed patient and physician viewpoints of preference of face-to-face versus telemedicine. So as you can see, physicians overestimated the patient's preference in office visits. So, however, the study still suggests that patients and physicians value in-person appointments over telemedicine. Again, this is a 2016 study, so with the advancements in technology, perhaps this has changed since it's already really depends on the person's preference and what they're dealing with. Okay, so let's talk about the effect of teletherapy as opposed to face-to-face sessions. So in a study by Wagner, Horn, and Marker, teletherapy was effective in its treatment for depressive thoughts as compared to traditional treatments. In another study done by Arcierno in 2014, teletherapy was effective in treatment for PTSD. Individuals with PTSD showed similar improvement for those treated face to face. That's going to be a big one to be treated post COVID via telehealth. So, again, your mileage may vary for those who struggle with building and forming relationships. Traditional face to face therapy really may be more beneficial. This should really be evaluated by yourself, your provider, and your treatment team. Okay, so here's a little recap of some of the things that you can do to ensure success during your teletherapy session. So you really want to create a safe, distraction-free, private space. It's really important. Expect awkwardness at first. If you haven't done this, there would be a learning curve. You have to learn the technology. Got to be flexible and resourceful with different tools the internet has to offer. If there's interruptions, maybe from a furry friend, don't be afraid to introduce them to your provider. Uh, Maybe even ease the tension a tiny bit or any other distractions. It's good to explain what's going on. Um, Practice being verbal with your emotions in the absence of body language and verbal cues. Can really most importantly is give your provider feedback. Talk to them about what's working, what's not working, and try to tweak it so it does work. And as we talked about, you really want to take the time to decompress, maybe before and after your sessions. All right, so now we're going to make a little transition to the provider sides of things. It's important for the patient to know the provider's perspective as well. So, as similarly stated for the patient, accessibility to the provider allows them access to patients in different areas and remotely. So workload management is improved because of teletherapy. It cuts down time for the provider, although the workload management may be heavily increased because of the demand, especially with what's happening with this pandemic. Another perk for the provider is if they make the switch completely to teletherapy, you can save on overheads such as cost of office space and many other expenses. So many therapists are really dealing with this currently. It's very challenging for them. having an expensive office space and not being able to deal with that overhead and see the people who they're normally used to seeing there. So, as discussed from the patient side of things, if done correctly, teletherapy can really enable for a positive therapeutic result in delivery of care. So you can continue to see the people who you're helping prior to COVID and post COVID. So this also brings us to some disadvantages for the provider. And there are unfortunately a lot of cons for telehealth when it comes to the provider. Um, so unfortunately, for some individuals that have a diagnosis for psychosis or mania, it might be really difficult for them to take part in this type of therapy. A lot of people who are experiencing paranoia, they're not going to feel comfortable enough to connect through an electronic device. This can really create a major communication barrier that might be easier to overcome in a face-to-face circumstance. So it's also quite difficult to express empathy digitally. There are a lot of factors that go into emotional intelligence and empathy that are conveyed in person. This is a barrier for providing delivery effective therapy. It can also be exhausting, just really exhausting for providers, especially if this is new to them. So, technology can be a major barrier for the provider using teletherapy. Any glitches or any type of platforms that aren't easy to use may make it harder for people who have disabilities or elderly who are not tech savvy to engage with them. The provider may have to use a facilitator to make sure that process is smooth. So that's building on another relationship. If you're even allowed to and you have the consent to do that. Another disadvantage is the lack of insurance coverage for teletherapy. Although recent changes have made it easier for the patient to be reimbursed, it's really important to know that the right billing codes and these tend to somewhat change frequently. It's imperative for the provider to check if the patient is in their insurance network and how they're going to be reimbursed. So, going back to that survey that I had mentioned previously, privacy and security concerns were evident on both the provider and patient side. Providers do not want to lose their clients' trust or compromise their own liability. This is understandable as everything in this form of therapy is relying on technology. So it's important for the provider to choose a HIPAA compliant platform, and there are many that exist that I'll get into on the next slide. So let's talk about choosing a HIPAA compliant technology. The most recent update of Zoom 5.0 has helped it become more HIPAA compliant since it's now encrypted. For that, there are people doing what is called Zoom bombing. That's when a stranger will disrupt your meeting or a session. You can imagine how one of your clients would feel if they're expressing some of their deep private thoughts and somebody Zoom bomb them into one of your sessions. Gotta kill any type of relationship you've had with them. Um, really hard to deal with. So other HIPAA compliant platforms such as Doxy.me and Theralink have tightly secured measures and are commonly used for teletherapy. So some of the boundaries to look out for as a provider would be issues pertaining to recording sessions and sharing your screen. So you really want to make sure you not reveal too much about your home or self that you're so you want to make sure your tabs are closed, your email is not open, pictures of your family or things that you want to keep private are not exposed, and especially the information regarding other clients. So make sure if you had a session with somebody else that that information is not anywhere to be found when you're sharing your screen. So let's talk about the most important aspect of teletherapy from my point of view as a provider, which is building rapport with the patient. So it's extremely important to get into a rhythm with the patient. Try to start off any of the conversations you're having with something light to break the ice. Maybe good to tell a little story or discuss something that you and the person have a joint interest in. You know, be sure to actually, try to connect with that person. So you want to use affirmations and encouragements, things like I see your point, to ensure that you're paying attention and listening, even though this is new and you're behind a screen. So you really want to, repeat what the patient is saying to you. That way they can understand that you're listening and that you're being attentive, and you really have a understanding of what they're saying. And as we talked about, body language plays a big role in building the rapport. So posture, smiling, head nodding, these are real, actual nonverbal ways of communicating that can make people feel much more comfortable when they're talking to them on a screen or in person. So you may actually want to put the camera back so you can see somebody's hands, the provider's hands, or their face more. So when talking, to make a point, you may want to, move closer to the screen. And there are other indicators to grab, patient's attention, and hopefully you can maintain that attention. If you have to write down notes or look away from the screen, it's a good idea to let the patient or the person know what the interruption is. Then you can move on from there. All right, here's a unique scenario that may present itself to the provider delivering teletherapy. All right, so in situations where a person has a diagnosis of schizophrenia and their main fear has to do with spying or generalized fear of technology, it's important to try to mitigate or quell those types of issues. There are apps like Signal that are known to be encrypted end to end to allow for people who have these types of fears to communicate without a problem. A lot of people really appreciate that, actually. So I want to inquire with that person about what platform they feel most comfortable with. So oftentimes I've noticed that they usually have one that they do tolerate more than the others. Um, and also, I've also noticed that that can change, and is very specific to each person. So hopefully through this pandemic comes the expansion of teletherapy and mental health services in ways that are more accessible and flexible than before. So this may include better insurance comfort coverage for the kind of therapy, may include improving quality and continuity of care, reducing the cost, and even access to the right experts for those in remote areas. Maybe get an assessment from somebody who's doing remote therapy. Um, you may see more doctor on demand type of services, which would certainly increase access, and hopefully more leniency from the government and insurance companies, and recognition by them that telehealth doesn't have to be a risk. So with the expansion of new technological innovations such as AI, 5G, virtual reality, chatbots, all sorts of wearables, telehealth may just become the new normal post COVID-19. So, in a time like this, with all this stuff going on, I wanted to share a quote from one of my heroes, Oliver Sacks. He talks about all different types of things in his work. He's known as the poet laureate of, of medicine. Um, so he wrote, I wish for a world that views disability, mental or physical, not as a hindrance, but as unique tributes that can be seen as powerful assets if given the right opportunities. Again, that's Oliver Sacks. So I'm going to open it up to some of your guys' questions at this point. So thank you all for listening.
Thank you, Brad, for providing this critical information surrounding telehealth. We would like to open it up now for any questions that you may have. Remember that every participant will stay muted to avoid background noise, but you can type your question into the question box, Again, that is at the right-hand side of your screen if you're viewing from a computer, or at the bottom of your screen if you're viewing from a phone. And I know that some people have had a hard time listening in today with the audio, but just so that you know, the recording has been, this webinar has been recorded and will be sent out to any participants tomorrow. So again, with that, let's open it up now, and if you have any questions, please enter them into the questions box. Okay, so we do have a lot of questions coming in now. Our first question, let's see. How do you know what type of therapy to use? I am a family member of one with diagnosed bipolar.
Well, that is an excellent question. And somebody who has a diagnosis of bipolar, I would often say, where did that diagnosis come from? And, you know, again, when you're trying to find the right type of therapy, whether it's teletherapy or not, you want to do a very thorough assessment and make sure that what's going on is what's currently going on. There are many people who have bipolar that are in remission or that they're actively symptomatic. So you want to make sure that you figure out what stage that they're in and try to figure out with a care navigator or some other resource to try to connect yourself with people who understand what's going on. So I would say that anybody who has a connection or who is able to be able to assess the scenario and then provide the proper treatments. And the proper treatments doesn't necessarily mean it's based off the diagnosis. So a lot of the times what has to happen is you have to see what's affecting the person the most. And you have to look at the person not from a diagnosis perspective, but as a whole person. So when you're doing that process, it's really important to figure out exactly what's going on with that person. And as a result of that, there should be a number of different therapies that pop up for those types of individuals. And it could vary greatly for all different types of people. Again, really, I really caution people to look at the nuances. If you're not looking at the nuances, and you're looking at this broad picture, you really might be missing something. So whether it's a trigger or something that is really stopping that person from being able to function, it's important to try to figure out a process and a plan to go through with that. And teletherapy and telehealth can certainly be part of that plan. And as I mentioned, getting a new provider at a time like this may be very challenging, but finding an expert and people who can do an assessment is really the first step. And if you know those types of things, then the types of therapy will really be much more clear.
Thank you, Brad. Our next question is, are licensed therapists required to have oversight by a physician?
That depends on what type of therapy you're providing. And I certainly don't want to give any legal advice that I am not, able to provide, as I'm not somebody that I'm a lawyer. But I would say from my experience and given the circumstances and my interpretation of the laws, if you are a licensed provider, um, you do want to do what's called best practice. And if you do not feel comfortable providing services on your own, you really do want to have oversight. And I would always say that you want to have oversight and some other clinicians or other people that you're bouncing your ideas off of. Creating a clinical team or clinical network is really an important way to go about these types of things to structure the most effective plan. So that's kind of my thoughts on that.
Thank you, Brad. Our next question, and I can speak a little bit about this as well. Are there any virtual support groups available for both the family and the client?
That is an excellent question. And again, that, you know, can actually be very individualized. So there are a lot of different supports groups, whether that's someone, you know, that person's individualized support group. Like a lot of AA meetings have now taken to the internet and being done through telehealth. Um, a lot of places that have been providing treatment in person have created communities that are online now, where they're having tele tea times and other types of ways of connecting with people. Um, People are using Netflix parties to connect with people, or going on virtual tours of museums or other things like that. So there are a lot of ways for families to connect through teletherapy. And, you know, there are families that I work with that um, they play music for each other or they dance. So really any way that you can think of can really be adapted to teletherapy. And if somebody wants to contact me off the podcast, I can give them a more a bigger list of resources of different facilities and different places that have changed over to provide teletherapy. Some of the interesting things is, you know, people who have been providing DBT or other therapies that haven't traditionally been taught um, through telehealth are now actually doing that and finding success in doing that. So that's quite interesting. People who have isolated may actually have an opportunity to engage in some of those places. So
Wonderful. And NAMI Maryland is also working diligently to provide online support groups statewide as well. Several of our affiliates have already done so, and those resources are listed on our website at namimd.org. Our next question is, what does increase in generalization skills mean?
I'm sorry, can you just repeat that one more time?
Sure, it says, what does increase in generalization skills mean?
Oh, that's an excellent question. So generalization is a term that a lot of clinicians use. I suppose I could have explained that a little better. So generalization is when you learn something in a different location and you have a hard time learning that same skill or performing that same skill in a different location. So say you were in somebody's office and you were learning how to do some sort of calming technique or some sort of, you know, skill that was taught. It may be much more difficult actually to do that in your own house or in another location. So actually practicing those things that you're trying to do in the location that you're doing them is a way to generalize the skill to the place that you need the skill, that you're going to be able to use the skill. So that's what generalization is. So teletherapy really helps to be able to do that because you can teach a skill in the moment in somebody's, you know, environment that they'll actually need to do that. So it creates the muscle memory and the mental memory of being able to do the skill and do it where the skill needs to take place. Excellent question.
Thank you, Brad. Our next question is, do you have suggestions for patients that may have a lack of technical skills, unfamiliar how to navigate or how to get support to use this service efficiently?
That's a really good question as well. I find that a lot of people are really struggling trying to figure out how to use this technology. And really, this is where the supports come into place. So hopefully, there's somebody in that person's world that is able to help facilitate the situation. whether it's a parent or a sibling or somebody that kind of will be allowed to be engaged. I've had a lot of situations where the person that I'm working with is really having a hard time dealing with the change from being face to face to being person to person, through telehealth, through a screen. So this really may need some prep. And as I talked about in the presentation, when you're desensitizing somebody, when you're making it more comfortable for them and getting through the awkwardness or trying to talk about what the barriers are for them, what things may concern them in a teletherapy session, and really trying to work through that with them. And you don't have to get through everything all at once. Maybe just a little bit is a big win. Like the Snapchat thing I was talking about. I don't want to be using Snapchat to engage with people, but if that is a first step and a way to move forward, then hey, maybe we have somebody that can get on the screen and learn something new. Um, and that's really a major goal, is to be able to get the other person or anybody else who's there to help facilitate that. You may really have to actually set everything up before that person just literally sits in front of the screen. So it really depends on the person that you're working with, but there's a lot of reliance, as a lot of parents and family members are experiencing. This has really been challenging for them. They've had to really step it up. I have to say, a lot of the parents are doing an amazing job, and the families are really doing everything they can. But these are really difficult scenarios.
Absolutely. Now, we do have quite a few more questions, but I know that we're running short on time. So, Brad, would it be okay if we answer those offline for those individuals?
Of course, I'd be more than willing to do that.
Okay, perfect. All right, well, thank you everyone for joining us. We hope that this webinar has been helpful for you this afternoon. Please remember that the webinar has been recorded and will be emailed to all registrants tomorrow at 12. The webinar will also be uploaded to our website at namimd.org for any individuals who were unable to register for the webinar today. We wish you all a safe and healthy week, and please do not hesitate to reach out to us should you need any additional resources or support. Goodbye, everyone, and thank you.